Hi, this is Rahul from SnapDx, and this is a video walkthrough of the SnapDx clinical app for physical exam. So in SnapDx, we have a whole range of potential exam scenarios, and in this case, this is a suspicious headache that we'll be looking at. So as you can see, when the patient presents to the hospital or the clinic, there's a certain pretest probability that can be assigned to the condition that the patient may be presenting with. So in this case, there's a pretest probability is 32% of a patient who's presenting to the clinic of it being a headache suspicious enough to lead to further imaging. Of course, that pretest probability is changeable. So for instance, if you have a patient who is older, over the age of 75, who's got a family history of, neurological tumors, in that case, your pretest probability of the headache being suspicious is much higher, as opposed to somebody who's young with a known history of migraines, presenting to your clinic, in which case the pretest probability would be much lower. So in this clinical setting, let's assume that the patient is over the age of 50 presenting with a new headache. So your pretest probability is 20%. Once you have set the pretest probability, you can actually go through the different exam and history maneuvers that will help rule in the diagnosis. So in this case, let's assume that the patient presented with a thunderclap headache, which has a high likelihood ratio of 11. And suppose this is positive, in which case the app gives you a post-test probability of this headache being suspicious of about 73%. So if you were wondering about whether you should order further imaging for this patient, the answer would be yes. And if you look at the I button, it sort of goes over the features of a cluster type headache and a thunderclap headache, and gives you some of the studies behind that as well. And you can click back, and let's assume that you have this similar patient but otherwise healthy, and has a completely normal neurological examination, and this will help rule out a suspicious headache. So your pretest probability may have been 20%, but according to the app, based on the fact that the exam is completely normal, there's an 85% probability, given the patient is otherwise healthy, that this is not a suspicious headache. So maybe this patient may not need further imaging. So you can use the app to essentially help rule in different diagnoses and rule out different diagnoses. And the evidence behind the app is actually can be obtained by using the I button on the top. And you can look at the authors and where the sources for the information are. And if you want to become an author or send further feedback on a given physical exam scenario, please do so through the send feedback button. So that's the basic walkthrough. If you have any questions, please feel free to email us at info@snapdx.co. Thank you very much.